Emily is here. Thank you so much for being here, Emily.
Thanks for having me again.
Of course.
Medicare Con.
Medicare Con. That's right. So, Emily, I was actually in Destin, Florida, like a few years ago, and you had reached out to me something about ClickFunnels before I knew who you and Kim were, and we were talking like digital marketing because you guys were growing. You have a good base agency, and then we're trying to grow some on the digital side. And then I don't know if that phone conversation didn't go right, but Emily's like, "We're coming to Tupelo," and they just came. And actually, it kind of inspired the idea for behind the agencies as we started reverse engineering some stuff. But you guys also had things going on that kind of flipped the script, and now we actually partner with you on ACA and some other stuff. So, of course, we wanted to have you here to talk about that. So, getting into the business, you came in as in a completely different capacity than you did now, on a different side. And just from our conversations, I think it's been instrumental in helping you scale by understanding the other side that a lot of people don't get to. Tell us, where did you come into the industry?
Well, I originally started as a broker, but that was before like the CMS guidelines, marketing guidelines.
Yeah.
So, I mean, it was kind of like the wild, wild west, and you got paid, every 90 days. Agents were flipping businesses. I wasn't doing that, but I was introduced to it like, here's a summary of benefits, go read it and sign them up.
Yeah.
And, I went through the rite of passage of being aligned with the wrong people, which whatever. And then I was broke. So I went to I applied for a job at a carrier, Bravo Health, like way back in the day.
Bravo Health. Does anybody know Bravo Health?
I know one person here that worked with me that
knows here. Bravo Health.
I know she knows it. But yeah, so I worked as a carrier rep, training the brokers. We rolled out physician marketing in Houston with IPA groups, things like that. So it got acquired through HealthSpring and now Cigna, and I made it through those acquisitions, but I ended up leaving to go work for an FMO with the same person that's here, by the way, that worked with me at Bravo. And we did that for a little bit, but it was interesting because when I worked for a carrier, I knew what agents were missing. And then when I went to go work for an FMO, I knew what agents were missing. So then I started my own agency to see if I could fill in those holes myself, because I thought I could just do a better job. So,
well, you gave me some really good early. We were scaling and we're doing stuff, and we're kind of like we were talking about earlier, head down working. Wasn't thinking about some of the pie in the sky stuff. Emily comes to town to learn from us, and she ended up giving me a tip about carrier marketing dollars. I had no idea about this stuff at all. Like you'd think that I would have known all this, but we were so heavy med sup, and we had started pivoting into MA. And she gives me one tip, and I changed the way I communicated with carrier reps, and all of a sudden they're pulling out money that they didn't tell me they had before.
He literally goes, "This is why people write MA."
Yeah, there was a lot of additional funds when you could produce. We were already producing some of it and growing it, and but they were tight on the purse strings at first.
Yeah.
So
well, because I worked at a carrier, I knew that we valued our agent partners and agency partners, and you can grow your numbers with a carrier if you partner with them the right way and help them grow and scale their business, which is why we rolled out physician marketing way back then, because we were pairing agents with doctors that wanted to grow their panels. Mm-hmm. Because back then, like, everybody was on original Medicare, and it's not even a meds up. Yeah. And there's a lot of people that just original Medicare and a PDP.
Yeah.
And so when we were able to match the carrier with an agent, that's when actually their patients were being taken care of.
Yeah. So when you talk physicians marketing, who knows what? Raise your hand if you know what she means by physician marketing. Raise your hand if you don't know what physicians marketing is. Okay. So physicians marketing is a referral. It's marketing by building a relationship with a physician that benefits them in a way that makes them want to refer clients to you or patients to you. Some people think it's getting referrals from physicians. Well, if you just walk in and ask for referrals, you're not going to get referrals normally.
No, and not only are you not going to get referrals, but number two, you're not going to end up going back. That's where a lot of agents miss the boat on that, is they just want immediate gratification in some of their marketing. And I know sometimes I'm like, why is this not performing fast enough? but they would never go back and build that relationship and that trust. But you can't ever, with any referral partner, now we work with dentists and vision providers. We work with accountants a lot on the ACA side. We have so many different types of, we work with life insurance agents that don't want to be in the health space, group health insurance agents who don't want to do Medicare.
Yeah.
So whenever you're building referral partners, you need to bring something of value to them to where they're like, oh, well, we're going to work together. Kind of like how we're working together.
Exactly. A mutually beneficial relationship.
That's right.
No, so yeah, I mean, I don't want to, I won't even say what agent this is because he thinks I mess with him too much. But one of my agents went into we were talking about, getting referrals from pharmacies, and he walked up into a Walgreens, which is the worst one to go into because it's very corporate. But he walks in there and he's like, hey, if you got some clients that, need help with their drug plans, I could do that for you. I'd take care of that. And you don't have to worry about it. And I'm like, that did not intrigue them at all. Like, if you walk into somebody who has to pay the bills in that building, or has to worry about that, and you tell them, can I help? What drug plans are good for you? What Advantage plans do you like? Because I have customers already that come here, and I want to make sure I put them on plans that you guys like. That's how I would try to start relationships with those groups. Is how am I going to add value? Is that?
I mean, for us, we do more fact finding. Like, what are you hearing your clients complain about their copays? There's a bunch of people out there, obviously not in this room, that don't even look up prescriptions. So we'll have people who are paying $500 a month for one prescription in one plan, but if you put them in another PDP or another MAPD plan, they would only be paying like $100.
Yeah.
So a lot of times they're hearing those complaints. So what I try to do is, instead of them having to answer all the health questions or prescription questions and have all those complaints, I want them to just be like, you know what? I don't know, but Justin does. So call Justin.
Yeah.
Well, Emily.
Yeah.
Sorry.
Emily. So they can call me too. You can have them call me as well. I'll take care of them. Well, I won't, but no. So, with y'all's business, obviously you get a tremendous amount of referrals, just even from the consumers. This is the cool thing, guys. As you grow, your consumer referrals are a little bit natural. Some people ask how to get more referrals out of consumers, and there are ways to, elevate that. But really, if you just get a whole bunch of customers, they start referring you naturally. But what percentage do you think of new business is coming from physician referrals specifically?
Well, there's kind of a shakeup in our market a little bit, because when you work with certain physician groups, they want to start building their own agencies, right? So then you have to do some creative business strategies of how you can be a part of that, so you don't lose your book of business, right? Mm-hmm. So I would say we get about 40%, maybe 40%.
And then probably
from
another
referral partners, not just physicians.
Yeah, all referral partners.
And then the rest is like walk-in traffic. I mean, our whole business was built on grassroots, people coming into our office. That's why I was like funnel hacking during the pandemic and found you and Danielle on Boomer Benefits. But when I went on Facebook, you were easier to find and you had all these groups. So, that's when I was like, referrals is great and grassroots marketing is great, but it can't be our only thing, because what do you do in the middle of a pandemic?
Yeah.
Right. And also it was really hard to scale that. So that's when we're like, okay, we need to start doing Facebook or SEOs or, all the other digital stuff, which.
And that's, I think I was talking to Bob years ago. We were talking, he just kept bringing up lead diversification, I got to lead diversify. And he was so heavy into Facebook at it. So he was on the other side, right? And some of the stuff we were talking about was, at one time, he had some of these ideas that never came to fruition. I think there was one at one time he had talked about, like, getting in an RV and riding around the country doing like seminars and having filling rooms and different things like that. But all of the ideas he had were never like, I'm going to go do exactly what somebody else is doing. It was always, an unorthodox new thing. And so physicians marketing is something that takes some time to build, but even us early on, we worked on a lot of referral partners. And for us, it was pharmacists and P&C agents. I hear people doing, financial advisors and things like that very successfully. So, but people don't think of the
financial advisors
physicians.
don't know how to really plan for Medicare. I mean, they know a little bit, but they don't know, like, one of the biggest pieces of advice that I give them is, especially if they're, not as seasoned in the business, is, watching what people pull out of their investment accounts or their, pensions or whatever, because sometimes you'll pull out more money that'll push your Part B premium up, and people
Yeah.
don't know about it until they get the bill.
Yeah.
So whenever they know those little tidbits, it really helps them with their clients, which again brings value. And then also you sound like you know what you're talking about.
Sounds like it's really about 80% of financial advisors don't know about the IRMA penalty. I've
Yeah,
been
no.
so baffled at people that come in and, their bad investment advice led them to absorb a healthy amount of the difference that if they had just kept it down, they would have been able to keep. But and we've seen that. Actually, we have one right next door to one of our offices. It's Merrill Lynch. There you go, Merrill Lynch. It's them. They keep sending people over that are getting IRMA penalties. But and we're now that we're getting a little bit more into the financial side of things, it does bring up like, well, that guy clearly doesn't know what he's doing. We handle the Medicare too, so we can help you with this side. But anyway, I'm sorry if that guy's watching this. So what other markets, as you've started scaling the different marketing, what other avenues have you taken that's helped you get away from just the grassroots?
Well, we really leaned in heavy on ACA as a campaign for us because we had a lot of spouse in the house. We have a lot of people over the age of 55 who were getting laid off at that time. And so we just did some target marketing for them. We did mailers, we did some Facebook on that, but we just started talking about it. And then we used ACA really as a marketing campaign for us. And then we got so many referrals. I mean, or an additional business, but like last year, so our business has not always been organized. Like it is, we didn't even have a CRM up until a couple of years ago. So last year we pulled our ACA clients that were turning 65. And I think we had like 178 or something like that. So I was like, wow, like I don't have to spend any money to get those people because they're already in our book, And so we use that. We continue to go down the referral partners, but then because nobody wanted to do in the health space, we were able to work with a lot more agents, PNC agents, life agents. The financial advisors were okay, but a lot of group people. So we just have always leaned in heavily on the referral partners. But for us, it's not easy to scale that in multiple states. And so that's where we kind of had to start moving more towards the digital side.
Yeah. Yeah, and the ACA side for us has been great. We were actually using ACA before we could even write it, just to. And I was talking about this earlier a little bit with Galen. Is getting in the door with ACA when nobody else wanted to do it, and still there's not enough people that want to do it really for the volume that seems to be out there. There's a couple of agents in the room that I heard are like individual agents doing 500 and 600 ACA apps a month, just one individual. Fairly easy. I wouldn't say easy. Like I know they're working very hard, but really just able to churn that through. And a lot of it's because there's not enough agents, I think, targeting, unfortunately. But
they're not because agents have always made this. I did under 65 before the ACA, and the commissions were like awesome.
Yeah.
And then they like slashed the commissions like crazy. And all these agents that used to do that left. They're like, I'm not doing all that work for no $20.
That actually after ACE, there's a group in Tupelo that was our biggest competitor, and they were an all line shop. And they were a biggest competitor like when I came in, and it was around the time ACA fully took effect, right? And we started writing it and weren't really overly concerned with it. They closed the doors up, didn't sell just like, I guess, close the doors up, quit writing business, and let the renewals pan out over time, and went and opened coffee shops. And they're like, this is the death of insurance.
Yeah.
And
that's why I don't listen. I mean, I always pay attention to what's going on in the industry. I pay attention to what other agents are saying, but you have to make your own business decision about it. Because if there's an opportunity and everyone's leaving, there's still people that need access to that. And after all, we're in this business to help people. So if you can say that for a senior, why can't you say that for a family of 4 that is not offered employer group coverage or affordable employer group coverage?
Yeah.
Right? So you're here to serve others, right? As Brandon Clay said, and there's people making millions of dollars in ACA.
Yeah.
A lot easier than Medicare, I would say.
And it's a cross-selling gold mine as well.
Yes.
It's a gold mine for people who are close to Medicare age, and becomes a pipeline because now you've acquired them as a client. You have them in a CRM that's telling you, hey, now they're 6 months out from Medicare. We're sending them letters telling them we know they're within 6 months. They have an upcoming birthday, all completely marketing to them before anybody else is effectively marketing to them, and our marketing is going to work because they've already used us for one thing. And I can't even, like, at first they said the ACA commissions aren't good. It's really not true anymore. They're pretty sexy. And then the cross-sell commissions are great. And it's what's best for a lot of the clients, and not all of, there are obviously, loopholes where there's maybe short-term medical or other options that can work for different scenarios. But it's not like ACA commissions are bad.
No.
That's
And
kind
their
of,
networks are getting better. I mean, I think there's ideal clients for short-term medical. I think there's ideal clients for different other or various health insurance strategies. But there is definitely a need for people that need those subsidies. Or, I mean, I have quite a few people that are self-employed that don't qualify for subsidies that needed that full coverage health insurance because they have health issues. They're
Yeah.
not going to pass underwriting elsewhere. So
yeah. Yeah, there's always going to be your exceptions to the rule, but from and this could be a paradox of the marketing we have. We're very heavy in our ACA would be very heavy 50 to 64-year-old kind of blue collar mid range. A lot of them have retired, or their husband retired, or their wife retired, and now they're not old enough for Medicare, but they're getting pretty heavily subsidized most of the time. And I'm not talking about people that never worked. I'm talking about people that have held jobs their whole life, but their income dropped between now and the time that they go on Medicare because they've retired, and technically their taxable income is 35, 45, 50,000, but at that age the subsidy is heavy in that age block. But then you're able to solve that problem and get them into that chute. So
I think the only other problem that you have, so now we're starting to see this because we had a lot of people in their 50s, and now they're turning, late 50s, now they're turning 65, and they're like, I have to pay how much for my insurance?
Yeah, we have seen that. I don't know if
And you're
anybody,
like, sorry about that.
if you have, that has been an issue. Like when we take somebody who got a zero premium ACA and push them onto a med sup, and they're like, wait a minute, now I have to pay.
Yeah.
But there is this potential concept coming that I guess it's a policy change, and I'm not super well versed on it, but you were talking about it on one of our calls the other day.
Oh, the family glitch.
The family glitch being a potential kind of landslide of additional maybe upper middle or middle class beneficiaries coming into.
Right. And so the family glitch is, so it's interesting because our politicians, they don't realize where all these uninsured people are. They're like, why are all these people uninsured? And we're like, well, they're on these expensive employer group plans and they're not affordable. They're deemed affordable in the eyes of what the law says, but
because
it's not
they're going
affordable.
off of the employee's rate, not
Right.
the whole family's rate.
So yeah, so if you're on your employer group plan and let's say they pay for 50% of it and your premium's only $100 or $200 a month, but your family's is $2,000, that's a heavy burden to carry on.
Yeah.
And so they're talking about, or it's proposed, to fix that issue. So if they fix that issue and then offer those families subsidies, then there's an opportunity for agents, whether you agree with it or not, we're just working within the laws, right? There's an opportunity for agents to be able to help some of those families. Now, are there going to be, I'm interested to see what the repercussions are going to be for the businesses and things like that, because it's, like Galen said earlier, math is math.
Yeah.
So where's all this money coming from? So we have to wait and see how they finalize that.
And I'm glad you said that, whether you agree with it or not, because we often find ourselves we're navigating stuff for our clients, or we're building businesses to train teams to navigate for our clients. It's not about what's best for me or the country. In those individual consultations, it's just about operating in that kind of fiduciary capacity where you're helping them navigate to the best of their ability. And, whether that's ACA or short-term medical or Medicare supplement or Medicare Advantage, it's really not one of any of those. It's what's best for each individual one of those situations.
That's right.
And so, I find so much of that too. Like you'll get people in there, I'm not writing that because this is blah blah blah, and I'm like,
That's okay. Send it to me. We'll take care
yeah,
of it.
somebody's going to write it, like
Yeah.
or you're going to put your client on something that without exploring the other options. So when I started doing under 65 health, and I was working with like Galen on Manhattan Life Affordable Choice and all that, one of the things that we always looked at was we wanted to rule out ACA, and we would have agents that would go straight for an indemnity plan, without like exploring real options. And then if they got into kind of trouble for not painting a whole picture, it was one of the things she told me is always be able to show that you pulled up ACA and that for some reason that wasn't a fit. And so unfortunately there's a whole agent, I'm not going to name their name, there's a whole captive agency out there that only writes one product, and it's terrible, and it's in the under 65 space. And I don't even understand how they don't get sued all the time for it.
I don't either, because we get those phone calls and I'm like, nope, that's not how that works. So we'll take care of it. But hopefully they call in the right part of the season.
Yeah.
So we have to go back and educate all these people on this. So like we do radio, we do TV, mainly in the Vietnamese space, because that's where we are with
Speak
Kim.
some Vietnamese to us.
Yeah, I only know how to order food.
So Kim, who couldn't be here, Emily's business partner, is they do a lot in the Vietnamese space, and we have seen some other people that have hit like metro markets in different language markets. Like we've seen people in Russian or seen Polish markets where they're able to do that. But you guys have done really well in that, and I've seen it. I wish that video was around for us to send out, but the one of your walk-in office, because we kind of have a crazy walk-in office in AEP, TikTok. But you guys have like a TikTok video. Yeah. What's your TikTok?
Emily Trevino official.
Emily
first TikTok.
Emily Trevino official, the one and only. There's a video that shows that walk-in in open enrollment.
It was crazy, and they just keep walking in droves, and we can't hire enough people to like not have a wait. Yeah. And they don't want to set an appointment. They're like, no, I'll go get my hair done and come back in the afternoon. You're like,
we tried in AEP in the walk-in office, because like we're 70% by phone most of the year, but then there's people that just walk in. And a lot of people think it's service work, but we get a lot of it's new business coming in. But we tried setting appointments for them, and it didn't work because you'd set an appointment, and then 3 other ones would walk in and completely disrupt the flow of that potential appointment. And then the person that had the appointment was pissed off. Yep. So we just like, hey, it's just, walk in, first come, first serve.
That's kind of what we had to end up doing, because the appointments it was really bad. Everyone would just be so busy, and you can't predict like who's coming in when. Yeah. We keep track of it now through our CRM, is what's service versus what's actual enrollments, because we have haters out there that are like, that's just all service work, and I'm like, okay.
Well, it's like when I say I count apps and I count PDPs as apps, and Beige must think I do 90% PDPs.
I don't count PDPs either.
It's like 6%. It's a very small percentage, but I want my team to feel the reward of the fact that they had to work their ass off for that damn PDP.
And it is good internally, because you want people to feel, to kind of keep the motivation. But from a business perspective, anything that makes below a certain dollar amount, I don't really count.
Hey, it's revenue, man.
It is.
It's revenue.
It's in my P&L, but I just don't really in my mind.
Tack that onto my lifetime value. Oh.
Yeah, but our agents know it too, because obviously they get commissions on it. Our LOA team gets commissions on it, so
yeah, we try to pay it on all, because when we were doing initially when we started doing PDPs, we did get a flood of people coming in to get their PDP shop, because in our area was a lot of med sup agents, just really no MA in the area at the time. A lot of med sup agents that wouldn't do PDPs, and they were sending them to the pharmacists. Well, then the pharmacists started sending them to us, because they were getting these troves of Medicare beneficiaries. It was like, we'll take the PDPs. And then we were rewriting a healthy amount of their Medicare supplements because of that. And so when I see an agent who's young in the industry, when I say young, I don't mean by age, I mean by like how long they've been doing it. And they're like not really making any money, and they're like, I don't do PDPs. That's silly. Like now there's a point when if you have more than you could possibly hire to handle, that you might have to streamline out PDPs or create things like, I know Danielle's has like service people that focus on the PDPs, things like that. But
I mean, you can hire a service person, you can do like a virtual agent, or a virtual admin. I mean, we started using that. I mean, I got that from a podcast you did with Eugene.
Yeah.
And we have her kind of doing some of the heavy lifting on that, so that our agents can actually just focus on selling. So they'll kind of do a little bit of a fact find, like a pre-qual or a fact find, kind of look up some of that stuff for the agent, so that our agents are just closing business.
Yes. And then if they have to change the drug planner, so if you pop it back over to an agent buttons it up and all that. But it takes the the BS work out of it. So
exactly.
Yeah. Well, how much time do you guys spend on BS work then?
Last year we spent a lot of time on it. And that's why we started going to a bunch of events, because I was like, okay, we have holes in our business. Like, I don't know how to do automation. I don't know Facebook. I don't know like all this stuff. So last year was really a lot of us organizing. So now this year we don't have as much BS work that we're doing, because, Matt Timon and Steven have helped me out with automation. Victoria helps me zip zap stuff everywhere I need to go do. And that's what Danielle set up here is like, when you go to a conference, you need to find people that you can network with and bring value, which I've brought value to those people too. So, I'm not just like, help me. But because we develop a friendship, we're able to improve our systems and processes. And each one of those people are very good at their thing.
Yeah.
And then I'm kind of good at my thing, which is like general business stuff.
Well, they are all really good at it, and that circle doesn't have to be somebody else, so you can kind of cultivate it at your level. Find out who's somebody at my level or maybe slightly above in different ways. When I started meeting some of the people that have come on this stage, they were far ahead of me, and some of them are still ahead of me. But I came a long way because I was able to kind of get into those circles. But it was like marginal differences at the time, and it kind of, a rising tide raises all ships. So most of them would share different things, and people are not going to tell you everything. Like, I kept trying to get Jagger to give me his login to Google AdWords, and he wouldn't do it.
That's so rude. Why not?
I mean, he's like, trade secrets or something. I don't know. But he would share, like, for real, like little things that help you, like where you're like, if might save me, $20,000 worth of split testing over something. And a lot of it's theoretical even, because there's not like black and white in a lot of marketing. You're just trying to figure stuff out.
Much.
Yeah. And when I talk about, like earlier, I talked about spending $240,000 a test to TV ad campaign. Well, to some of you, like that might be spend $10,000 and lose it. It would be the equivalent to that, or $5,000. It's not all relative. You don't necessarily have to spend $240,000. I was doing a big, concept, so I was shooting for the moon, so to speak. And but you can test things on a much cheaper budget. And some of the more dialed-in marketing, like Facebook, you're not bleeding quite as much to test those strategies. So.
Oh, you're not. And eventually, like a lot of the stuff on the marketing stuff, I've haven't outsourced to people because I had more money than time, So I was like, let me just do this. But ultimately, I am the only person that can do marketing effectively. So I have to force myself to learn it, because it's the only way that I will, even if I do outsource it to somebody else, I will be able to hold them accountable. And I learned that lesson the hard way last year, which you helped me through that as well. But ultimately, when you own a business, you are an entrepreneur, you need to start thinking like that, and you need to understand that you are your best marketer. So you need to be in charge of your own marketing. And if you want to outsource it, it's fine, but no one's going to be able to sell it as good as you.
Yeah.
So.
No, yeah, you're always going to be the head of marketing for your business. You might hire people internally to help with different specialized tasks. You might bring on outside help to help with certain specialized tasks, but to believe that you're going to outsource marketing completely and that somebody's going to do a great job at it, it just doesn't work that way. A marketing agency should really be for design, or maybe they build this or they do that. But if you think, I'm just going to turn it over to them and I'm going to just sell, because I've heard this recently from a couple of people, but really recently somebody told me, well, I'm not good at marketing, I'm just good at sales, so somebody else could handle the marketing. And I said, but what you're describing is going and being a sales agent working for someone else. Like
Yeah.
if you don't do any of the marketing, you're not involved, just like Danielle said, she learned, she went and learned those tasks before you bring on somebody else who's hopefully better at it, or you can at least train then.
Right.
But you can't even speak their lingo. And so then a lot of times marketers that'll sell marketing can also sell you on the concept with things that you don't understand.
Right.
And so if you don't understand it, you might be buying snake oil. And there's a lot of that out there.
There is a lot, and that's why you have to do your due diligence and learn. I did it the wrong way. I mean, I should have done it the way Danielle did it, but it is what it is, and now we're moving forward. So, but you have to make the right business decisions, and you can't just rely on stuff on the internet or overinflated premium amounts or dollars or revenues, or you just gotta focus on what you're trying to do and hold yourself accountable to doing your due diligence on that stuff.
Absolutely. So, well, awesome. We are having a great time here at Medicare Con. You have, you were at Medicare Con,
I was at the first
the
one
first one.
where I met all those people
Yeah.
that I just talked about.
Is this better than the first one?
Oh my gosh, it is way better.
Okay.
First of all, it's not in Memphis.
Everybody kept telling me last year was good, and I was like, you guys are lying.
Yeah.
But
I thought it was good.
The good thing, it was
We were-
good people were there.
It was good people, and that's all that really mattered,
Yeah.
because it doesn't matter where the venue is. However, I really love how clean and attention to detail it is here. And the hospitality has been really nice, because instead of us having to leave the premises to go buy an overpriced bottle of water, you have it here, and I can stay and hang out with agents and chit chat about
That's
seminars.
it. It's the
and all that.
networking. The networking.
is.
And
So you
so
secured
so
that.
don't go to bed after the event.
No.
Go into the bar, because when Beige starts drinking, he gives away good secrets. Trust me. So, what is one takeaway from last year that you had, 2021, that did change? I know, obviously, you said like meeting certain people. Any relationship or piece of information that really helped?
Well, my relationships were absolutely key. I didn't know anybody, and that's kind of weird, because I was on Facebook, but I obviously wasn't following the right stuff.
When you were already doing well too,
Yeah, we
I
were
think it
doing
was just like
fine.
maybe a plateau in potential to scale in other avenues.
Right. And so when we came to Medicare Con, I mean, I went to a couple of other events not related to this, but to this industry. But when I came to Medicare Con, I met great people that are kind of doing the same things that I'm doing. And I'm like, and I'm super competitive. So I'm like, if you can do it, I can do that too.
Yeah.
So how are you doing that? And then, I taught some people some things too that help them expand their business and build revenue and things like that. But I mean, for me, the most important thing is relationships and loyalty in those relationships. Because we're all agents, and again, we're all competitors, but there's so much business out there to be written. And the fact that people are willing to help you and share information with you because they're not afraid of you to go snake their client. I mean, that is just something incredible that you've put together. So that was a really that's my number one takeaway from
And
Medicare Con.
what is one takeaway from what you've experienced from getting into the industry till now that you would think would be a practical thing, maybe that's not overly stated, that you would give away to people?
Okay, so I talked about this at Rebecca's win retreat, and I'm gonna say it again because it's something so important for us. But I do feel like agents really need to prepare their businesses now for like a succession plan. The reason why I say that is we had one agent pass away a few years ago, and the only thing she told her family was to call Kim and I. Well, Kim and I were like, well, what do we do, And so we had to like figure all that out. It took them like a year. We had to get somebody licensed and then, get the book of business transfer. There's like a whole process. But the thing is, at the end of the day, we started telling all of our agents. Well, February of last year, we had an agent pass away, and he didn't do any of that. He didn't do any of the advice that we gave him. And it took us, he passed away in February. We weren't able to help his wife get any of the commissions, any of that until September, because she had to get licensed and we had to get her appointed. So on my cutout that somehow keeps making its way around the conference, there's a QR code, and I will email you a checklist that I did to help prepare my husband for in case something happens to me, if something happens to Kim, her husband knows, it's kind of like a cheat sheet for like, who the hell do I call so that I can inherit my family's business? Because we just spent a bunch of time, energy away from our families, a lot of arguments. I'm right there with Bobby with the arguments with the spouse. And we worked so freaking hard for this. So if something were to happen to you, your family has to go through hell to inherit your work. So protect it and make sure that you take care of that. And I'm going to go talk to Gabriel Tovar because he's heard this thing 3 times and he better have taken care of it. I know he's in the back. So I'm going to hold him accountable to that. But it's so important because we just had a pandemic. We had a bunch of people who've passed away through that, from COVID. And that is not something that you can predict for yourself. So that is a really important message that I want everyone to know is you've got to freaking take care of your business. Have a cheat sheet. Have a plan for your family. That's it.
Yeah. No, that's awesome. And it is very important to have, a succession plan. We just bought a pretty decent sized book of business, and going through just the book of business transfers for that. Thank you to a lot of people in the room that helped me through it because, we have relationships with Precision, Senior Security Benefits, Heartland, Innovative Financial Group. All 4 of them had to have reps helping with those transfers, and I learned a lot in the process. But that was with me and Kelly and Mallory that worked with me, kind of, and it's all not moved still. I bought it December 27th. And I still have, and anyway.
It'll be December 27th.
It'll be December 27th before I'm done.
I've done a couple acquisitions myself, and it is so hard.
It's like there's trickling in little,
But here's the thing, all y'all know the industry, all y'all know the acronyms and who to call and all of that. But your spouses don't, your kids don't.
Yeah, it's like a foreign language.
It is.
It's like Vietnamese. They can fake and order food in Medicare, but they can't legitimately speak Medicare.
What do you mean fake? I know how to order food.
Oh, okay. You're for real. It's not fake. I legitimately order food.
But
I can't order food.
Order more than just that. Just make a full.
It is a foreign language for sure. So definitely take care of that, guys. And you're all insurance agents, so buy yourselves $5 million long-term term policies and some other stuff. So I've always been baffled at how many life insurance licensed people don't have life insurance.
Or how about
health
insurance?
It's even worse on health insurance. Way worse than health insurance.
Yeah, no, it's terrible.
Well, awesome. Thank you so much, Emily.
Yeah, thanks for having me.
Absolutely.